Welcome to Nguyen Nam Podcast channel. No matter how big they get, we like to think of our dogs as eternal puppies who will be with us forever. As much as you may wish to deny that your pup is getting older, it's important to keep an eye out for senior dog health conditions so that you can help improve his quality of life. Keep listening to learn about common health problems in senior dogs that might one day affect your pet. When is a dog considered senior? On average, a dog is considered senior when they reach 7 years of age, although it really depends on the size and breed of the dog. Very large breeds age more rapidly than small breeds. While a Great Dane would be considered a senior by age 6, a tiny Chihuahua may not reach that status until 8 or 9 years of age. Of course, other factors, such as genetics and environmental conditions, can affect how an individual dog ages. Once your dog starts showing signs of age-related health issues, they can be considered a senior dog regardless of their true age. Here are 8 common health problems in senior dogs. 1. Hearing and vision loss. Tissue degeneration in the eyes and ears can cause varying degrees of deafness and blindness in older dogs. Senior dogs are also prone to developing cataracts, which Pet Health Network defines as a cloudy layer that forms over the lens of the eye that can cause partial or total blindness. Even without surgery to remove cataracts, dogs can still manage to get around well due to their good sense of smell and excellent hearing. A number of issues from genetics to chronic ear infections can cause hearing loss and deafness. While deaf dogs may not be able to hear you talking, they will be able to feel vibrations on the floor when you approach, and you can use hand signals to communicate with them. Always take precautions when you are outside with a dog who cannot hear or see well. You don't want them wandering away and getting into trouble. 2. Joint problems. Osteoarthritis is the most common cause of joint pain and stiffness in dogs. This is a progressive degenerative disease that causes loss of lubrication and the wearing away of cartilage in the joints. Although there is no cure, there are a number of treatments that can help reduce pain and slow the progression of this disease. Nutrition, especially omega-3 fatty acids, plays a strong role in supporting dogs with joint issues. Ask your veterinarian about foods available to support joint health and if a therapeutic food would be beneficial for your dog. 3. Dementia, cognitive dysfunction. Like people, dogs can lose cognitive function as they age, resulting in symptoms similar to those of senility or Alzheimer's in humans. Confusion and disorientation, whining or barking for no apparent reason, appearing to get lost in familiar surroundings, and bathroom accidents can all be signs of cognitive dysfunction. These symptoms can also indicate other conditions, so it's best to talk to your veterinarian if you notice these behaviors in your dog. Like arthritis, there is no cure for dementia, but it can often be helped with certain medications and antioxidant-enriched foods. 4. Cancer. Older dogs are prone to getting lumps and bumps, and luckily, not all of them are cancerous. But age increases the risk of cancer in dogs, so it's best to get any strange lumps checked out. Regular checkups and cancer screenings can help catch tumors that aren't easily seen or felt. 5. Heart problems. Heart disease can also develop as dogs age. One condition in dogs is congestive heart failure, which occurs when the heart isn't able to pump blood efficiently and fluid backs up in the heart, lungs, and chest cavity. Coughing, difficulty breathing, exercise intolerance, loss of consciousness, and unexplained vomiting are all signs of possible heart disease and should be checked out by a vet right away. 6. Obesity. Your dog's weight can have a significant impact on their health, especially as they age and become less active. Older dogs carrying excess weight are more prone to illnesses, such as diabetes. Obesity can contribute to and complicate the treatment of heart disease and joint problems. In addition to providing as much exercise as your older dog can safely tolerate, it's important to feed your dog age-appropriate meals to make sure they are getting the right balance of nutrition, as well as the correct amount of daily calories. 7. Gastrointestinal issues and incontinence. A number of problems can cause gastrointestinal issues in your aging dog. While not always serious, gastrointestinal problems can point to problems, such as kidney disease, so if vomiting or diarrhea doesn't clear up quickly, it's best to talk to your vet. Also, older dogs sometimes have urinary accidents as the muscles controlling the bladder weaken, but again, Incontinence could be a sign of a bigger problem like a urinary tract infection. Accidents can also be an indicator of possible dementia. If these issues are not a one-time occurrence, it's best to talk to your vet. 8. Kidney issues. Aging kidneys tend to lose their function as dogs get older. While chronic kidney disease can't be cured, it can be managed with proper treatment, prolonging your dog's life and improving their quality of life. Routine blood work for your senior pet can catch kidney disease in the early stages and improve your dog's chances. Proper nutrition is also extremely important for maintaining healthy kidneys, so if you have any concerns about what you're feeding, be sure to consult your veterinarian. Getting older is as hard on your senior dog as it is on you. One of the best things you can do for your aging pup is to take them for regular wellness checks every 6 months, to screen for these common health problems. Keeping an eye on them at home and reporting any unusual behaviors to your vet can also help catch these illnesses early, improving your dog's chance at a long and healthy life. They may not be a puppy anymore, but they will always be your pup.